Welcome to Part 1 of the Mieinray D3 Defibrillator Training Series. The following symbols indicate the power and charging status. The green wave icon illuminates when the device is plugged into AC mains power. The yellow battery icon illuminates when battery is charging. The green battery icon illuminates when the battery is fully charged. If no battery is detected, no battery icon will be seen. When a red cross is illuminated, this could be due to a device failure or because the battery has been removed. Check the battery and conduct a device test procedure, which is explained in the next video. If the error persists, contact your medical engineering department. The green tick indicates the device is functioning correctly. In this video, you will be shown how to use the manual defibrillation function. To prepare the patient for manual defibrillation, remove the patient's clothing around the chest. Wipe any moisture from the chest. Clip or shave any excessive chest hair. Attach the pads to the chest. Use the standard anterior lateral placement position. If not already connected, connect the pads to the patient shock cable. Next, turn the mode dial to manual defib. To begin delivering a shock, select the desired energy level using the Energy Select buttons. For adults, users can select energy outputs of 200, 300, and 360 joules. To charge, press the Charge button. Once charged, the user will hear a change in tone and see a flashing shock button. When ready and it is safe to do so, push the flashing shock button to defibrillate the patient. To help ensure successful defibrillation, an impedance indicator can be seen on screen. A green light indicates an acceptable level of impedance. Amber and red lights indicate that impedance is too high. Users should not delay delivery of the first shock regardless of the impedance. After the first shock, high impedance can be reduced by checking the pad positions and cables connections. Changing the pads should also be considered. After the rescue, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. In this video, you will be shown how to use the AED function. Turn the mode dial to AED.
Apply pads.
The D3 checks if the pads and shock cable are connected. If not, the message Apply Pads will appear on the screen. There is the option to change the patient category between adult or pediatric using the navigation dial.
Analyzing now. Do not touch patient.
Once an ECG trace is detected, the device automatically analyzes the patient's heart rhythm and warns the user not to touch the patient.
Shock advised. Charging.
If a shockable rhythm is detected, the D3 automatically charges to a pre-configured energy level.
Do not touch patient. Press the shock button.
Follow the device's voice and visual prompts. When ready, press the shock button.
Shock delivered. Paused. If needed, begin CPR.
After delivery of the shock, follow on-screen instructions. An audible metronome tone is to assist with CPR delivery. To adjust the volume, press the soft key. If the user does not wish to deliver a shock, the device will automatically disarm after 30 seconds.
Analyzing now. Do not touch patient.
If a non-shockable rhythm is detected, the device will not charge.
No shock advised. Paused. If needed, begin CPR.
Follow the audible and on-screen instructions until a senior clinician or responding emergency team arrives. After the rescue, turn off the device. this video, you will be shown how to use the synchronized cardioversion function. Prepare the patient for therapy in the same way as directed in Part 4 of this training series. Apply the electrode pads and ensure a good contact. Connect the pads to the patient's shock cable. Turn the mode dial to manual defib. Select the desired energy level. Energy levels for cardioversion are determined locally for broad and narrow complex tachycardias. To ensure safety during cardioversion, synchronize the shock with the R wave by pressing the Enter Sync button. Confirm using the soft key. Once performed, white markers will appear above each R wave and a green sync label will be visible on the screen. To charge, press the Charge button. When ready, and it is safe to do so, push and hold down the flashing shock button until Shock Delivered is displayed. For subsequent shocks, please ensure the white markers are visible. If not, press Enter Sync again. To disarm and not deliver a shock, press the Disarm button. To help ensure successful cardioversion, an impedance indicator can be seen on screen. After the therapy, turn off the device. In this video, you will be shown how to use the external pacing function. Turn the mode dial to Pacer mode. Lead 2 is automatically displayed in the ECG waveform area. A white marker will appear above each detectable R wave. If the R wave markers do not appear or do not coincide with the R waves, select another lead. Change the pacer rate by pressing and rotating the navigation dial. Press the navigation dial to select the desired rate. Pacer output is adjusted in the same way. When pacing, the message Pacing will appear. On-screen pacing spikes show that pacing is activated. Electrical capture is indicated when a pacing spike is immediately followed by a broadened QRS complex. The ECG rate will increase to match that of the pacer rate. It is recommended to check the patient's pulse at this point. To review the patient's ECG rhythm, press and hold the 4-1 button. For safety, a pacing spike will still be delivered every 4th beat. To resume pacing, release the 4-1 button. For advanced functionality, select the Screen Unlock button and follow prompts on screen. After the therapy, turn off the device. In this video, you will be shown how the automatic and manual device testing procedure works. The D3 will automatically perform an automated, routine self-test at 3 AM every morning to ensure the device is functioning correctly. If the device passes the self-test, a green tick will be displayed. If the device fails the routine self-test, a red cross will appear. If this occurs, perform a manual test. If the device fails again, contact your medical engineering department. To perform a manual test, the device must be connected to mains power. Next, ensure the device is clean and all cables are intact with no breaks. If damaged cables are found, do not perform the test and contact your medical engineering department. Connect the shock cable to the test plug. Turn the mode dial to monitoring to power on the device. press the main menu button. Using the navigation dial, highlight and select User Test. A message will prompt you to end patient monitoring and enter the test menu. Select Yes. Once in the test menu, ensure Routine Test and Energy Delivery Test are both selected. Select Start Soft Key when ready to commence the user test. A warning message will be displayed to ensure paddles or pads are not connected to a patient. Select OK to confirm and continue. During the test, the user is required to push the yellow charge button and the shock button when prompted. The device will now request to repeat the process using the battery. Follow the on-screen instructions. In the final stage, a prompt screen will ask the user to continue the test if using paddles. In most cases, you will not be using hard shell paddles, so select Cancel. The device will now display Test Completed. After the test, the soft keys provide 3 options: Transmit, Record, or Return. Press Return to complete the test. If the device fails the test, a red cross will appear on the front of the device. If this occurs, repeat the test. If the device fails again, contact your medical engineering department. A green tick will be displayed if the device passes the test and is functioning correctly. Once the user test is complete, press Exit and turn off the device.